Now, back to being done with my first semester. Some tips that I can give you as far as surviving ultrasound school and surviving your first semester. It was hard. I'm not gonna lie. I have never really been a morning person, and I have to get up at 6 o'clock. Sorry, gotta get back up. So I've never really been a morning person, and I get up at 6 o'clock every morning. I probably should get up more at 5:45 to be on time. My guilty confession is, you guys, I have been late a lot to school. Don't be late. Don't be like me, and I promise that I am not gonna have that issue when school starts back. But yes, I think that I'm going to start waking up at 5:45, and I'm going to start leaving my house by 6:50. Right now I get up at 6 and I leave my house by 7, supposedly. I never really make it out by 7. Most of the time it's after 7, which means that now I'm pressed for time, literally. So I'm going to change that. But yeah, time is big. Time, attendance, and tardiness, don't make that a bad habit, you guys. I'm cutting that habit out. I'm going to try my best to cut that habit out now. It will hurt you, and the worst thing that you want to do is to get on academic or clinic probation. Because for my program, you can only get either or both. You can only get on them twice before you're put out the program. Thankfully, by the grace of God, literally, I was not put on probation. And I can't thank anybody but God. But yes, time is everything. Another thing I can't stress more than enough is to please read something. Read something, look over something, watch a YouTube video, whatever the case may be. Do something pertaining to school and your class and what you're learning every single day. Even if it's for an hour a day, do something. Do not fall behind. I am in an advanced ultrasound program, so things are moving extremely fast. But with any type of clinical healthcare program, it's going to move fast. It's going to be a lot of material. You don't have a second to fall behind. You don't have the time. You're continuously learning. It has been times where we had 3 tests in 1 week, and we're still learning new information. Don't fall behind. It's too hard. It's too hard to keep up. It's too hard to catch up. It's too hard to study effectively when you fall behind. So the best advice I can give you is, please go and look over something. Watch a YouTube video. Get an understanding of things. Read something at least 1 hour per day, minimum. Study. Know your anatomy. Know your anatomy to the T. Your basic anatomy 1 and 2, take it serious. Take it serious. Make sure you have a clear understanding of it, because sonography is nothing but anatomy. And if you don't have a good concept of anatomy, if you don't have it down packed, you are going to still be learning it when you get into the program, and it's going to be somewhat of a challenge. It's going to make your studying and understanding that much harder. It's a lot easier if you just go ahead and get out the way, have a clear understanding, know where everything is, where it sits. Know that the bladder is anterior to the uterus. Know that the reproductive system, it goes vagina, cervix, uterus. Just know these things. Know where the kidneys sit in relation to the liver, the pancreas. Know the lobes of the liver. Know where it's at. Know what the pancreas is. Know where the stomach is. Know some of the muscles. The muscles have always been a struggle for me, but you want to know, just know some of the muscles. More so of the organs intact. The veins and the arteries, know them, especially the main ones, I would say that. So know the aorta, the IVC, what comes in, what comes out, what branches off. That'll make your life so much easier. What goes out to the arms, what supplies the abdominal organs, what supplies the pelvic organs. Know the muscles that supports the pelvic, the muscles that supports the abdomen. If you don't do anything else, if you had to pick and choose what you would remember to a T about anatomy, you want to remember every organ in the body, where it sits in relation to everything else. Yeah, that's all I can say about anatomy. Know it, because anatomy is sonography is all anatomy. That's it. It's 100% anatomy. The more you have a good understanding about anatomy, the better you'll do. The less pressure it'll be on you. At least you can relax. You'll have a lot more relaxation at that point when you know your anatomy to the T. Do not change your answers on your test. I can't tell you how many tests I've taken where I could have made an A, but I made a B because I just second guessed myself. Find a method to the madness when it comes to your testing. Try to get a good night's sleep before. My schedule has been super crazy, and that is a little bit of why I was getting to school late. I really wasn't getting much sleep. I was running like off of 3-4 hours a lot of the days of sleep. Get a good night's sleep, especially on test days, but pretty much every day. Try to at least get 8 hours of sleep if you can. But yeah, when it comes to test taking, please, you guys, have a method to the madness. Don't let your test anxiety drive you crazy, because there's been plenty of tests I've taken where I could have aced it and I made a B because I went back and changed my answers, and all of the answers I originally put before I changed it were correct. Let's see what else. Study, study, study. I'm trying to think of what other good advice I can give you. Make a good impression at clinic. Soak in and absorb every place you go to when you start doing your rotations. For us, we start doing our rotations immediately when we started the semester. So I think maybe the second week of school, we started going to the hospital. Brand new, fresh, not knowing anything. We were in the hospitals. It is intimidating when you are a new person. You don't know anything about sonography, anything about any scanning, what you're looking at. It's a little intimidating because you feel like you're there, you've been thrown in the water, and sometimes you can feel like the sonographers thinks that you should know things, because sometimes some of them will talk to you as if you've seen it before, but you just have to remind them like, hey, I'm brand new, I really don't know much, I don't know anything, honestly. And they are really helpful sometimes. I've in my experience, they have been really helpful. Everyone has told me that you'll go to places and they do not like students, or they don't really want to be bothered with students, or they may not be as helpful, or I say all of this to say you'll have good rotations, you'll have bad rotations, you'll have okay rotations. What you want to do is be a great sponge at any rotation, whether they like you or not. Don't give back the energy that they give to you. They feel like if you get the vibe that they don't like students, don't be nasty back to them, because you're constantly on what we call a job interview the whole time you go through these rotations, through your whole program. So if they don't like students, just do what you can. Just don't let it get to you. You have to have tough skin. If you don't have tough skin, grow it now, because this is the work environment that you will be in. Everybody will not be friendly. Everybody won't do things the way that you want them to do it. It won't be taught the same. Everybody won't like you as a student, and that is okay. It's the process. Unfortunately for me, I feel like it's unfortunate. I feel like, to become a sonographer or a nurse or a doctor, whatever, it doesn't matter. Whatever you're doing clinically in the medical profession, everybody had to be a student at one point. We all had to go through the same process. So for me, I honestly don't get why there's some people out there who don't want to be bothered with students, because it's kind of like, well, you were once a student. You had to do this before. But it happens, and what you can't do is allow it to get under your skin. You'll sometimes feel as if the people around you that you're in class with, that they're catching on faster than you and you're not getting it. Let me tell you one or two things. Most of the time, they are at the same point that you're at, for one, and they're just acting like they get it, and they really don't. And you have to remember that everybody moves at a different pace. If you're picking up on something slower than everybody else, or what you feel like is slower than everybody else, don't beat yourself up about it. Don't get down. Don't feel bad, because you'll get it. We are now one semester, and I have been to 3 different hospitals, 3 great hospitals. And I still feel like I don't know much as far as scanning wise. As far as what I've been taught and what I've learned, I've learned a lot. But as far as how good I am with my scanning, I don't feel like, I'm not confident still. And people keep telling me, every person that's a sonographer, whether they've been a sonographer for 3 years, 5 years, 25 years, 30 years, they have all told me the same thing. It'll come. One day you'll wake up and it'll all click. I've had several new sonographers tell me it wasn't until like the last 6 to 8 months that it finally clicked. And I mean, don't beat yourself up. And that's easier said than done. I know personally, because I'm telling you. And I'm telling you because it's been told to me. And I'm still having a hard time because I just feel like, man, but I should know. Like when I'm looking at the screen and I'm like, how did you see that? I couldn't see that. And they're like, it's just a sonographer eye. It'll come with time. Keep doing it. Repetition, repetition. You guys are still new. You're only 4 months in. That's still fresh. It'll come. So I'm telling you, it'll come. Don't let it defeat you, because it has almost defeated me or made me feel like I'll never get it, or this is too hard, or I just don't understand, or I just can't get the scanning technique. Listen, breathe. You got this. I'm here to tell you, you got this. It'll be okay. Just take it one day at a time when it comes to the scanning. When you go to these rotations, absorb everything that you possibly can in. Be helpful. Do not be that student not paying attention, not asking questions, looking and feeling and acting like you don't want to be there. Help them stock their room, and you don't have to ask them, oh, do you need me to get you towels? If you see that there's towels low, or it's gel low, or it's sandy wipes low, get it. If they're done with the patient and you guys are finished scanning and they're walking the patient out, or they're, helping the patient get to their next appointment, whatever the case may be, wipe down the bed, wipe out the probes, wipe out the machine. Be helpful, because you're being watched by everything you do. They're watching you. Everybody's watching you. You're on a constant interview process. So be mindful when you walk into that hospital. No matter where you are in the hospital, even if you're not in the radiology department or the ultrasound department or the emergency room, wherever you're going to be working for that rotation, be mindful. Be friendly to everyone that you come in contact with, even if they're not friendly to you. Go get the patients for them. Verify the patient's first and last name and date of birth. If it's anything that you need help with, if it's anything that you're struggling on, when you're in these rotations, let them know and ask them, is it anything, any advice you can give me, any way you can help me? Can you show me how to do this? Can you show me how to get past this rib shadow? Can you show me how to straighten out this kidney? I always get my kidneys in their oblique. Whatever the case may be, ask, engage, act like you want to be there, because these people are there to help. Now, one thing I will tell you is that each place you go to, they may have a different protocol. They may do things a different way. Just take heed to it. It will happen. Everybody is not on the same protocol. Some people will do scan assist. Some hospitals won't do scan assist. Right now, most hospitals will only let the students do scan assist with the leads. Some hospitals won't, but most of them will. So just be mindful. Go in there and have your own protocol. And right now, I'm still working on my protocol because I haven't scanned as much as I want. But for each scan that I do, I try to get a protocol in place. If you're at one hospital and that's not their protocol, they do their protocol differently. When you go and scan, they'll normally let you do the protocol to a certain extent, how you feel comfortable. You just, when it comes to like abdomen limits and abdomen completes, that's when the protocol gets a little more stern and stiff, because it's so much that you have to scan, and you don't want to be all over the place. You kind of want to be in some type of order. So that's probably the only scan that you'll have some type of, you can't go all over the place, you know, just because it may be easier for you to do the left kidney and then the right liver and then the pancreas. No, have some type of order with the things that you do as far as scanning. I'm trying to think of what else. Be on time. Be nice. Be helpful with the patients. Do as much as you can to assist when you're there, because you're there as a job interview constantly. Trying to see what else. There is one thing that I'm going to show you at the end of this video, something that can be helpful for me. One of the biggest things that I struggle with is the vascular system. All of the veins and the vessels and the arteries that comes in and out. But in my program, my teacher did a Play-Doh. We had a Play-Doh activity that we had to do that made it really helpful as far as learning the vessels, the abdominal system, the vessels in the abdominal vessels. I think that's what it's called, that chapter. And that's probably one of the first chapters you guys will go over. Another thing that's good in helping you understand the scans, the orientation, and somewhat of a protocol, your scanning book. Everybody would probably use a different scanning book. You may use the same scanning book, not 100% sure. But in each chapter of your physical sonography book, they kind of go through like the proper protocol based off everybody's standards. So every hospital is supposed to follow, or usually should follow, the sonography protocol, because it's pretty similar. Now they may tweak it and do a little bit of things different, but as far as what you need, what you're looking for, it's the same protocol. And in the sonography book, at the beginning, they usually start the chapter off, or sometimes in the end, they'll let you know which transducer to use, which position, if you want them in supine, or can't think of the other position, Lord. Decubitus, sorry. If you want them in supine or decubitus position, the type of transducer, the frequency, the echogenicity of it, the texture, and then what all you should scan. It's like somewhat of a protocol in the book, so that's something else that can help you out. But yeah, that's it. That's all the advice I wanted to give you. That's some things I wanted to talk to you about. I did end the semester with A's and B's, thank God. But yeah, just make sure you know that anatomy, frontwards, backwards. Just have it down pat. Make sure you're reading something, looking over some information at least 1 hour per day, every single day. Don't fall behind. It's too hard to catch back up when you fall behind, so don't do it. But good luck to everybody that's applying to a sonography program. Good luck to those that are in the sonography program, that's starting their sonography program. Y'all got this, you know. Breathe, stay positive. Do not try to compare yourself with those around you. Don't let that little voice in the back of your head deter you. I'm telling you, it's too easy to get distracted and too easy to get discouraged. You got this. Trust me, it's no walk in the park. I'm not gonna lie, it's not a walk in the park, but it's not impossible. If you're determined, if this is something that you really want, you'll do it, and you'll do good at it. So I've had some people tell me that they failed a lot of the tests their first semester. It was really hard. Some of the past people I talked to, and some people that I know, and it's just like everybody has a story. And most of the people's story isn't, oh, it was a walk in the park, it was a breeze, I made all A's, I just got it. That's nobody's story that I talked to. It's some people who cried their way through the whole semester because they were so stressed out, and they'll go home and they'll cry every night. It is, do whatever you have to do. But at the end of the day, get back up and be prepared to learn. Another thing, one last thing I did want to mention. My school has limited hours as far as us be able to scan in class. If you go to a school and their program offers open labs where you can do it late at night on the weekends, you have some flexibility, take advantage of it. It will serve you good. Take advantage of it. Get your hand on that transducer as much as possible. One of the first things you want to do is make sure you have the orientation down pat when you first start. That's really important. It'll make your life and your program life a lot easier. So get that orientation down pat. Continuously put your hand on that transducer. Scan as much as possible. Use your resources. If you have an open lab, I wish we had an open lab that we can do it on the weekends or 6, 7, 8 o'clock at night. I wish we did, but we don't. If your school offers it, take advantage of it, okay? But that's it for me for today. I start orientation at my new job next week, and we're on break. So you probably won't see me at all. The Monday following Mother's Day is when we go back to school. So that's when I'll have the next video, probably. Unless anyone has questions that they want to answer, then I'll do another video. But you guys take care. What I did for you guys was make each one of the vessel systems, and I'll quickly go through them. Hopefully it'll help you guys when you get ready to do the veins and arteries and the vessel system for your anatomy. So this is the aorta. So with the aorta, this whole thing is the aorta, and you start with the celiac axis. So branches of the celiac axis is the splenic artery, the left gastric artery, and the common hepatic artery. The common hepatic artery then turns to formulate the proper hepatic artery, and a branch off of it is the gastroduodenum. The proper hepatic artery goes from the right hepatic artery to the left hepatic artery, and then branching off is the gastric artery. So remember, celiac trunk, left gastric artery, splenic artery, common hepatic turns to the proper hepatic. You have the branches of the right and left hepatic artery, the cystic artery. This is cystic. I said it wrong the first time. This is the cystic artery, and then you have the gastroduodenum. You come down, and on top, here you are superiorly, you have the superior mesenteric artery, or the SMA. And you come down, and you have the right renal artery and the left renal artery. You come down, and you have the right gonad artery and the left gonad artery, which are the 6 arteries. You come down, and you have the inferior mesenteric artery, or the IMA. So remember, the superior mesenteric, superior is towards the head, so it's at the top. Inferior mesenteric towards the feet, or the bottom. And from there you have the common iliac. So this right here is the common iliac, and it branches off to the right external iliac artery and the right internal iliac artery. And then from the common iliac artery, it also branches the left external iliac artery and the left internal iliac artery. And that's the aorta. From the aorta, we move over to the inferior mesenteric. And with the inferior mesenteric, we have, this is the whole IVC. We have the middle hepatic vein, the right hepatic vein, and the left hepatic vein. Remember, we're talking about the patient's right and left, and not our right and left. So the patient's right and left will always be opposite of our physical right and left. Never get that confused. The orientation is always the patient's orientation of right and left. After the right hepatic, the middle hepatic, and the left hepatic, we have the right renal vein and the left renal vein. We come down again to the common iliac, and it branches off to the right common iliac and the left common iliac. From the IVC, we move over to the portal system. The portal system, you have the right and the left portal vein. The main portal vein makes the right and left portal vein. From the main portal vein, you come out to the splenic vein. It branches to the splenic vein. And then you have the superior mesenteric vein and the inferior mesenteric vein. Remember, it's always the patient's right and left. So hopefully that'll make it helpful to someone else. I thought it was a great idea that our teacher had us do a Play-Doh activity with it, because it made it a lot different. And then we would put these together and we'll have the whole system, but for time's sake, I'm not going to put them together right now. Okay, guys, it is one thing that I want to mention. I left out, totally forgot. It wasn't until I got in my car and went on about my day that I finally remembered. It was something I was leaving out, something that's very important to remember when you get into the program. Organ size, the measurements, the length, the width, the height, and the AP, and also the echogenicity of that organ compared to other organs is very important. It's a very important concept to remember. Those are two very important details to remember and to understand and to always take with you in class and in clinic, because that'll help you when you're in class and or clinic to say, well, hey, this person has a fatty liver. You know, if the kidney is darker than the liver, then they have a fatty liver. You always want to make sure that you know proper sizes of the liver, the gallbladder, the pancreas, the kidney, whatever, every organ, because at least you'll know if it's in normal range or if it's in abnormal range. And that's something good to know. You know, if you don't know anything else when you go to clinic, that's something good to know. You know, any little jewel or gem that you can take with you to clinic as a new student is a plus. So I was just riding down the road in my car and I'm like, gosh, I didn't even mention echogenicity or making sure you know the correct measurements for normal and abnormal organ, or whether it be crown rump length, or the CRL when it comes to OB, or you know, the mean sat diameter. Those things are very important. So I just wanted to come back and let you guys know that those are two other things that I think that you should know. Some things that you should maybe just jot down. Like, so when I go to clinic, I have like a little notepad and I just jot certain things down. So maybe you can have that just jotted down in a notepad or just on an index card, something on the side, so you can just pick up. And you know, you can, if the sonographer is scanning a kidney and they do measurements, you can look at the measurements on the screen and say, well, this person has an abnormal sized liver, a gallbladder, a common bile duct, whatever the case may be. But that's all I wanted for you guys. Y'all have a good night.